So, yesterday we finished regarding the compliance things. Today I'll cover like continuing from that quality assurance, and in this we need to finish proofreading and editing. We have discussed about like in case of proofreading. Um, yeah. This is important to identify any errors which are in transcribed reports, and transcriptionists they basically review the text for all grammatical formatting inconsistencies. After that comes the quality control measure, and in this basically the reports they are pre-reviewed, and a second level of quality assurance checks are done. They help to ensure accuracy and reliability of the transcribed reports. There is a need of continuous improvement because transcriptionists they need to adhere to professional development, and for this they need to have a feedback from their superiors. They are supposed to participate in various training programs, and they need to stay updated for any kind of like best practices which are held in industry, so they can keep their skills updated. They need to upgrade their skills, and also it helps in a improved performance in their domain. uh, yeah, okay. Now coming to confidentiality, it has certain perspective like whenever patient information is transcribed, a confidentiality has to be maintained so that the patient data is secured, and it is, excuse me, it is only accessed by authorized people. So encryption is one of the solution so that the access can be access can be prohibited to people who are unauthorized to these information. Next to that is secure transmission. So transcriptionists they use methods for transmitting and receiving dictation, and these transcribed reports um, they have to protect them from unauthorized access. So sometimes the documents they are protected by using secure passwords, and also encryption is utilized so that unauthorized access can be prohibited. The compliance has to be with the privacy regulation also. So, like we have discussed about HIPAA, so this is used to protect patient confidentiality and privacy rights. So, transcriptionists they have to adhere to these things so that they can prevent any kind of breaches and unauthorized access. So, we can conclude by saying that if we consider accuracy and compliance in medical transcription, and if the transcriptionist they have a better understanding of medical terminologies, and they give like attention to each and every information, especially detailing. So then there is a stick to all quality assurance measures, and one of the most important component is commitment to confidentiality and data security. So when transcriptionists they adhere to these things, and they consider and ensure accuracy, so this is how they can support patient care and compliance with the regulatory requirements. Now coming to step 5, which is utilization and distribution of prepared miscellaneous medical reports. So in this, first one is integration into EHR. So for EHR, there can be two things: centralized repository. In this, medical reports are integrated into electronic uh, electronic records, Then this allows healthcare providers so that they can have access to comprehensive patient history, treatment plans, and diagnostic findings. So, the usefulness of centralized repository is that all the information it is on a single portal or single server, and they can be fetched by multi stakeholders for the referral. Coming to streamlined access, so once the information is integrated with EHR system, it enables healthcare providers to retrieve all the information and review transcribed reports in a very efficient manner. This also provides a quick access to relevant information, which facilitates in first of all the quality of patient care, and also it helps in informed decision making. Coming to communication and healthcare providers, so it helps in two things. First is facilitating collaboration, and second is timely delivery. So transcribed medical reports, they serve as communication tools, and various healthcare providers like nurses, specialists, physician, the whole team actually rely on these information for any kind of insight, and to coordinate the treatment plan of patient and monitor patient progress. Okay, so these they basically, this communication with healthcare providers, they facilitate collaboration, timely management of healthcare, and also efficient service delivery to the patient. Now, coming to timely delivery. So, distributing transcribed reports in an efficient manner ensures that timely communication is done, and collaboration among healthcare provider also helps in rapid access to updated medical information. And this somehow facilitates seamless coordination and improves patient outcomes. One of the important aspect is patient education and engagement. So we are doing two things. First of all, so we are empowering the patients, and on second note, we are promoting informed decision making. So when a patient is there who is undergoing any kind of healthcare treatment or diagnosis, it is his right to understand what all what he is going through, and what treatment plans are decided for him, what are information available to him. So along with that, he should understand certain things. So understanding of medical condition, what are the treatment options, and health outcomes are very important, and these are like right of patient. So by reviewing their reports, basically patients, they get an opportunity. Depending on that, they can ask multiple questions, and they can somehow actively participate in their own care plan or treatment plan. Now, based on the insights into their report, they can make a decision, and somehow this is how it promotes a informed decision making, because when a patient, they understand their health condition and about various options for treatment, they can uh, they can take a decision suitable to them in multiple aspects, like accessibility, or for example some caregiver is there at home, or sometimes financial options are there, so they can take a informed decision as per their flexibility. Okay, and as per their all certain other background things. So um it is like this is very much recommended, because patients, they can follow these intervention, and this empower patients to engage in self-care practices. Now coming to legal documentation and compliance. So if we talk about official reports, so these reports are used as legal documentation in medical malpractices cases, also insurance claims, disability determination, and other legal proceedings. Coming to last point in this is compliance requirement. So all the healthcare facilities, they must maintain accurate and complete records of patient so that they can comply with any kind of regulatory requirement and accreditation standards. Transcribe reports, they play a crucial role to meet all these compliance obligation, and it actually helps to ensure any kind of accountability in healthcare delivery. Now, coming to what kind of role these medical reports can play in research and quality improvement initiative. So first is data analysis. So if we see like transcribed medical reports, they contribute in valuable data for research and quality improvement initiative. Researchers, they analyze databases from transcribed reports so that they can identify any kind of trends, patterns, outcomes which are related to any specific health condition or treatment plans. Also, in making any decision for clinical decision, this also support in that, as any findings from any kind of research studies which are based on these transcribed reports, they help in informed decision for any clinical options. And this somehow support system, and this is generally evidence based, these are generally evidence based guidelines. This helps healthcare providers to make any informed decision about what all patient care options they have, and also like treatment strategies they can plan. Coming to continuity of care and follow up. So in this case, there are two things. First is supporting continuity, and second is monitoring progress. So if we talk about supporting continuity, so transcribed medical reports, they basically support continuity of care by providing comprehensive documentation of patient encounter, and more important, various treatment plans. So the healthcare provider, they actually now, because they have access to all the relevant information about the patient, like what are the diagnoses, about the medical report, about the investigation done, or microscopic reports they have. So they understand, and also about the prescription and treatment plans, the medical history. So based on this, they know like what is ongoing, what are the like treatment plans going right now, and how the patient is responding to them, and later on, like in future, how the prognosis can go, how like for example different plans or some alternative treatment plans, they can be adopted, and this is how follow up, and according to that, appointments for follow up can be managed. Second is, it also helps in monitoring progress. So with the help of transcribed reports, patient progress over time can be monitored. If there are any changes in medical status or the health condition of patient, along with that, if like the treatment is working or not, and also like how effective the treatment under which patient is, they are like how the patient is responding to all treatment plans. So by regularly reviewing transcribed reports, like adjustment to treatment plans and can be made, and you can say if there are multiple options, so the best possible option can be adopted so that patient can have a faster recovery, or the condition of patient can be improved. So if we can summarize the whole like medical records by saying, like for example, like if we utilize and distribute the prepared miscellaneous medical reports, they play a critical role for certain things, like they help in enhancement of communication. They also help in collaboration among various like people, healthcare providers who are involved in the healthcare plan. Then these also act as medico-legal documents whenever there are some insurance issues. At that time also, these transcribed reports, they act as evidence. And also these medical reports, transcribed medical reports, they give an opportunity for improvement. And then in the care of healthcare settings, it helps in continuing and also monitoring of treatment plans, what are the best effective options available. And by leveraging these reports in an effective manner, all the healthcare providers, they can improve patient outcome. They can promote efficiency, and it also helps in to ensure compliance with regulatory environment. If we conclude this, so medical transcription, as we have been discussing from past few days, it plays a vital role in the preparation of miscellaneous and medical reports, because this help in transcribing the dictation, which is patient's history, prognosis, treatment. So they are transcribed in a accurate manner. Also, this provides clarity, and it helps to comply with the certain formatting guidelines. And all the information of patient, it is there in a repository, and it helps to maintain the confidentiality and accuracy of all documents of patient. By following established procedure, adhering to ethical and legal standards, and then utilizing medical transcriptions effectively, the healthcare providers, they can actually enhance communication, documentation, and decision making in healthcare. So I think just a second. Mm, okay, so this completes your first 5 topics. Yeah. Okay. So I have already covered. Okay, so I have covered management, implication, tools of transcription, ethical and legal and confidentiality responsibility, preparation of miscellaneous medical reports. Okay, Priyanka, are you there?
Ma'am, I'm here.
Okay,
Yes,
okay.
yes.
Yeah, okay. So now I'll be just going through some general principles for complete documentation in medical records, and then we are done with the module. Okay.
Okay,
So
ma'am.
let me share. I will share my notes also. Okay, the updated
Okay.
one I will share.
Okay.
Okay,
Yes.
so yeah, just give me a second. Just let me have some water. Yeah. Okay, now coming to last topic for like this module is preparation of miscellaneous medical reports. So there are certain essential principles for medical documentation as well as for transcription also. So first we'll take principles for medical documentation. I try to use certain example also. Okay, so first principle is accuracy and precision. So what is done in this principle? Basically, it helps to ensure my slide. My you can see my document, no?
Yes, ma'am, I can.
Okay. So yeah, just a second. Hmm. Okay. So, yeah, so this ensures that information it reflects patients' true clinical picture, and it avoid any ambiguity, and it use certain standardized terminologies which can be understood by all like medical care providers who are going through these medical reports. For example, in a document, if medication dosages are mentioned, example 10 mg, okay, not one tablet, and instead of some vague terms like few, so hypertension instead of high blood pressure. So these are few examples when where there are certain standard terminologies which are used across all medical documents or reports, so that any doctor or any healthcare staff they can refer these standard medical reports. Coming to timeliness and completeness, so all the documents they need to be complete so that they ensure that these reports are accurate, because half written information or incomplete information that can only lead to confusion about any treatment plans planning or it will not show a complete picture about patient. So along with that, there is also a need to include all relevant information so that comprehensive records can be maintained. Coming to the example, so when we document patient's assessment and treatment plan immediately after visit. So whenever a patient comes to the healthcare facility, their transcribed reports they need to be done on very promptly. They have to be done promptly. It's not that it takes like weeks, because once transcribed reports are there, only then health treatment plan and like follow up everything can be implemented once we have these reports. Also along with these clinical history or diagnosis report, other relevant reports like laboratory reports or other microscopic reports, they have to be they should also be included in main reports so that proper follow up and recommendation can be done. Okay. Coming to clarity and legibility. So whatever information is communicated, it should be clear and concise. Or the handwriting, it should be like legible if it is used. But as we have like discussed that transcribed reports are always electronic records. So instead of using certain jargons, too many abbreviations, it is used it is a best practice to use simple sentences and avoid medical jargons so that they are easy to understand. Now, coming to this, there are certain like EMRs can be used so that there is a improvement in the readability. Coming to objectivity and impartiality. So, the base documents are actually based on factual observation and evidence. There is a need to avoid any subjective opinions and personal biases. For example, document patient reports feeling pain instead of pain patient is in agony. So any personal perspective or personal information, it has to be the doctor or transcriptionist, they have to refrain from using some personal touch or some personal information. All like impartial documentation has to be done. Okay. uh, for example, the focus should be on any kind of objective findings. Example, like they are mentioning the height, heart rate, or blood pressure. Now, coming to confidentiality and privacy. We discussed a lot about this in detail. So, patients' privacy under human subject protection, it is mandatory. There are certain regulatory compliances which has to be maintained, like we talk about HIPAA. So, also we discuss in great detail, the like access to sensitive information of patient, it should be only accessible to authorized staff. So example is like, again, like HIPAA regulation. So there has to be adherence to HIPAA regulation so that patient information is secured. And along with that, there should be access controls, and also there should be audit, so that a monitoring can be done on these access points. Okay, next is documentation of informed consent. So, a consent for using the information in medical records, they have to be taken from patient or the family. And also it should have like if there like a patient is undergoing any kind of like research activity or clinical research, they get agreement with that. So they need to be acknowledged, and patient, they need to be educated about the whole process, and what are the options available to them. Okay, for example, patient who is undergoing any kind of surgery, so they need a consent is like mandatory to be taken from them, and they need to sign them. And for example, patient, they have certain concern during the consent process, so they have to be educated about the process. Whatever query they have to these queries, they need to be clear to the patient. Coming to collaboration and communication. So, when a patient undergoes any healthcare, like utilization of any healthcare services, there are multiple healthcare providers, and together they work and to provide service delivery. So, communication, clear and honest communication among all these people who are playing a critical role for service delivery, they are, it is very important to maintain a like communication. And and second is like document patient education and communication. So there are two parties, one is the healthcare provider and second is the patient or patient family. So there will be, we can say, intercommunication and intra communication. In intercommunication, the communication like stays between the service delivery providers, or like doctors, nurses, or any kind of like healthcare staff. Whereas once they have a consensus about like treatment plans and other intervention, that this has to be conveyed to patient, the second party in this case. So the transcribed medical records, they have consultation notes. They also have treatment plans which were like shared with a specialist, and all the recommendations from specialists. And then these documents, they should have clear instructions about medication, and what are the like follow-ups, how the patient can take care once they are back to their home, or about like other like self-care options and follow-ups. Coming to legal and ethical compliance, so we have discussed about this, like we need to adhere to legal requirements and ethical standards, because all the medical reports, I mean the like medical reports which are transcribed, they can act as medical legal document. So first of all, though, these documents, they have these all the information, they have to be documented, and secondly, they should be in compliance with HIPAA and other accreditation standards. So also it should respect patient autonomy and confidentiality. Now coming to like what are like general principles when we talk about complete documentation in medical records for medical transcription. So these are quite similar to what we have discussed like earlier, like all the medical reports and medical transcribed records, they basically follow same kind of principle, but we can just go through them. Okay, so the first principle is accuracy and precision. Okay, so in this, what happened when we transcribe the verbatim for complete capture of detail? In this, precise medical terminologies are utilized. Like if we talk about an example, so as the example is quite similar as we have discussed in medical records. So accurate medical term has to be used, not some vague terms. So the doses, they should be like medical standard medical terminologies, like in case of like 10 mg, it should be 10. It should be the actual quantity, rather than some vague term like few. And then always use the standard term for any kind of medical condition, like in this case hypertension, instead of just using high blood pressure or something. I just want to share one example. In my hometown, there is a cardiologist, and I'm just sharing it, like because it just came to my mind. So my father is also a doctor actually. So some patient came to him with a prescription, and you know what? There was written, and from the he came from after like visiting some cardiologist, and there was one term written, some English in English, some something like that. And we were very it was very difficult for us to understand what was it. And later on we realized that the cardiologist has just written ghabrahat in English. Okay, so I mean, and
Oh,
I was like very, because everybody was like very surprised, like what is this? What kind of medical terminology is this? So it was just ghabrahat. So you can see like how you are going to express ghabrahat, and then it was not in it was not even in Hindi. It was written in English, like GHABRAT something. So I mean, it just came to my mind. It was like some 20 years back. So these things happen. So yes, so that is why it is very important to use standard medical terminologies. Okay, coming to timeliness and efficiency. So prompt transcription for up-to-date record is very important, because when we prioritize that timely reporting should be done. Here it is mentioned urgent cases, but I think when we talk about medical care, nothing is like delayed. Everything is urgent. Everything has to be like addressed in a priority manner. Okay, and that is why it is very important. Like we can take help from the technology, and we can use software, so it can like facilitate the process, it can speed up the process, and it can help in to automate repetitive tasks, and to remove any grammatical errors. Nowadays there are so many, you say, software for transcription. We have already discussed about, we have gone through the list. Okay, so these basically help. And also these like help in uh, you can say reducing the workload and workload on transcriptionist, and it helps to improve their efficiency also. Now, coming to clarity and readability. So, clear, concise, and well formatted reports are acceptable. They are understandable by everyone who are working with those patients. These can be understand by anyone. Okay, and a consistent formatting, it ensures professionalism. Okay, so use of simple sentences rather than making the report more complicated using some personalized like this ghabrahat word. So rather using all these, I think in this particular case the cardiologist might have just used anxiety, that was easy to understand, but I don't know why he was using those. And then we saw like a pattern for that, so I don't know why he was using some personalized term. So it is better to use medical terminologies rather than some personalized sentences. Also, there should be uniformity in the formatting, like headings or bullet points. Every document should not come as some personal document. A standard protocol should be utilized for this. Then coming to compliance with the guidelines and standards. So already there are well established industry standards and there are HEPA regulation. So it is just like everything is available. The only thing required is adherence to these industry set standards and HEPA regulation. How they can be do? So just simple thing is just implementation. Okay, so everything is already in place. Just now the most important part is implementation of few things which are like encryption and secure data transmission of reports. Coming to confidentiality and security, so we have been going through this a lot, like all the it is like right of patient, like to secure his information, it is their right, one has to follow this. And this can only be done by restricting the access and also using multiple encryption technologies, so that it's important to restrict the access. But nowadays there are so many breaching in online systems, so it is also important to protect any kind of, you can say, breaches during transmission. Okay, because we know like many agencies, they hack the databases, they take patient information. We can, like in day to day life, we can see, for example, any patient they registered, I don't know from where these agencies they get their number, they keep on sending them for medicines and all that, I don't know. So somehow the data is leaked. So and the patient, they are subjected to like insecure and their sensitive information is shared with so many vendors and everything, other agencies. So transmission is also very important. Now also, it is important to undergo training and stay updated. How it can be done? Just to participate in all workshops, capacity building trainings, so that whatever like new advancements are done, they are up to date with them. Next is collaboration with healthcare providers. So I think in today's world, this is the most important thing. When there are so many people who are working together, so it becomes more important that the communication is effective and also open, because then only they are able to understand what information actually started from the first point, you can say. Because as in Hindi we say like earth ka anarth. So when information is shared among multiple people, what was initially written can be distorted, can be changed multiple times. So it is important that everyone is on same page. Also, whenever we talk about like improvement, it can only be done by feedback, because feedback helps to improve the quality of work. And example can be like clarify any ambiguities in dictation, so that whatever like the healthcare professional they wrote in their document, it is understood by the transcriptionist. It's not that just because of ineffective communication, or just you can say the transcriptionist is not in ease to go back and understand, or he is under like stress, he doesn't want to clarify the things. So the wrong information is transcribed. Also, they can incorporate feedbacks so that more accurate information is jotted down. Coming to the last point is quality assurance and quality control. So the practices to ensure accuracy and reliability, they need to be implemented. How these can be achieved? Uh, first and foremost is proofreading. So cross checking helps to remove any kind of inaccuracy in the document. And for example, if certain errors are found out, then they need to be edited. And again, from a seniority level, again these documents, they need to be reviewed. A monitoring system can be placed so that all the reports, they can be like checked for any kind of quality control issues. And we can then also utilize some peer review. In this case, it helps to catch any errors. And double checking always helps to identify and rectify any kind of errors. Okay, so this just a second. Yeah. So this completes your this paper. Okay. Hello.
Yes, ma'am.
Yeah. So actually, yeah. So I was just trying to say. So this covers your whole paper on system management and medical transcription. Okay. I try to complete whatever information was given in your syllabus, and I try to restrict to it and make it like make it more tabular and simpler so that you can just go through it. When is your exam about this?
It starts on 16th, ma'am.
Okay, 16th of May.
Yeah, this coming week.
So when is the system management paper one?
It's first paper only, 401.
Acha, acha, it's first paper.
Hmm.
Okay, okay. So what I'll do, I'll just share the your which the notes I made na. I will share it on group. Okay, and I will also share this highlighted wala document.
Okay, ma'am.
Okay, and
Ma'am,
in
can you
Mhm.
can you share those these tabulars, ma'am, separately?
Which one?
This last one, general principle for complete documentation.
I will
There
share.
are two
Actually,
types, no? So
I
where?
have made it in a same document.
Okay, okay, okay,
Okay, the whole paper I have made on a same document. I kept
okay,
on updating that. So I will share that also and this PDF also.
okay,
Okay, and in
okay.
any case, now if you have any issues, you can just just message me.
Sure, ma'am.
Okay, yeah. If
Yeah.
you have any issues, just keep in mind I am 2.5 hours ahead of you.
Okay,
Okay, so yeah,
okay.
yeah. That is the only thing. Otherwise, मतलब बहुत late मत करना.
Okay, okay,
Otherwise,
ma'am.
I'll respond on the next day. But
Yeah, yeah, I got.
you can just call. You can just call me on WhatsApp, or
Yes.
you have my number is there on the group. Just call me, or if just message me in case you need any kind of help. I am there. Okay.
Okay, ma'am. Thank you, ma'am.
All